Welcome to Turnpaugh Talks. We're here with Dr. John Brow.
Good morning.
Good morning. He's a functional doctor here at Turnpaugh Health and Wellness Center, and we're just expanding our introduction to the community of Dr. Brow. So, want to start off? Can I call you John?
Sure,
Okay,
absolutely.
John. With kind of give us a background of not from birth, but how you got here. And what steps you've taken, your background, what led you to schooling, and how you got to where you are.
So probably around 10, I had an experience with my dad who hurt himself and in a lot of pain. So he was headed to the doc, so I went with him. And my dad's a pretty big guy. He's about 6'2", probably then around 250. And he went into the chiropractor. Small guy. Guy was about 5'9", maybe $150. My dad's hunched over, walks in the room. Half hour later, he walks out standing upright. I was like, what just happened? Never seen my dad in pain. And all of a sudden, he was in pain, out of pain. I'm like, I got to understand what this is. So he'd gone back. I went and I sat in the room with him and understood. I'm like, I want to be a chiropractor. And that's at 10 years old. That was my journey to start. Expectations of going to school, got out of school, and then it was, as you have, the ever-evolving, hey, there's got to be something more. Did some rehabilitation studying, so I got a diplomate in rehab, went on to the chiro neuro program, graduated there, so I'm board certified in chiropractic neurology, and then...
Well, tell me, stop, this rehab program, how long was that?
It was about a 3-year program. So the last semester in school, I did an orthopedic residency and then moved back to New Jersey rather than finishing, but picked it up through a postgraduate rehab program.
And what does that entail? Is that more like physical therapy?
A lot more along the physical therapy, a lot of functional movements,
Okay.
A lot of the work by Dr. Yanda out of the Czechoslovakia.
Okay.
He was a professor over there, so a lot of his basic work. Craig Liebenson ran the program. He's written several books about that functional movement. And so that was a great part to really help people to understand their body movements, mechanics of why they're injuring themselves and trying to find ways around, people sitting all day long at work. Get up and move a little bit. They need to get up and start moving.
So then you go back, you start practice, and then you do the functional neurology program, right? Tell me a little bit about that.
So it's a 3-year program, postgraduate program through the Carrick Institute, which is out of Florida.
Well, that's where you did yours, but there's others now, right?
Right. There's a couple. I believe there's one National College is starting one, I think, down in Texas. They do a program.
Okay.
So I did that program, kind of traveled around through the country. So the 3-year program I went through and finished in about a year.
Oh, wow.
Yeah, so probably every month I was traveling somewhere to do it. And then there's a subspecialty within there that I did for childhood developmental disorders, which I believe you're part of as well, and you've done that.
Yeah, so tell me about that. What is a childhood development? That sounds like a mouthful. Childhood developmental disorder. What is that?
Right. So they teach you about children that are within the spectrum, which now we call it a spectrum. They don't so children with ADD, ADHD, children with autism, dyslexia, so within that whole autistic spectrum disorder of how to kind of help the children with, the functional movement, how to support their brain, how to support their body, their brain, and their health.
So this would apply to any like neuro-atypical child. So somebody that doesn't fall within the norm, whatever that is, right?
Right, and part of it was that, but without that understanding, I believe, which you understand a lot better because you've dealt with more of that atypical, which the presentation is, there's a lot of atypical, but people can't fit them in a box, so they don't get the help that they need.
So within that program, were you interested in functional medicine at that point, or was that just is that on your radar or no?
Yeah, I started to do a little bit at that time, picking up bits here and there and trying to integrate a little bit of it. And that was probably about 10 years ago. realizing along the way, chiropractic had its limits. Then it was the neuro. Then adding the functional medicine component to that really expanded and started seeing much better results with patients.
Nice.
Like really pulling them out of that box that they were kind of still stuck in and couldn't get past.
Yeah. So it's interesting. It reminds me of a story from our friend Tom Culleton. Great guy. I love him to death. Super smart, like really, really smart and amazing doctor. Great professor. And he was saying how he went through the neuro program and then he sat in his first functional med lecture. And he was like confident because he's very talented. So he carries with that confidence. And he was like, I don't know anything about this stuff. Like, I don't know. Somebody comes in and their brain isn't working correctly. And then he was asked through the lecture, not pointed out, but so what do you do if somebody has anemia and can't get any kind of blood flow to their brain, and that's the reason they're not functioning well? What kind of blood tests are you doing? I'm not doing anything. So I think it's interesting to think, and we learn these silos, and these silos have all the answers until they don't, right?
Correct.
Then you go into the next silo and it has all the answers until it doesn't. So, and it sounds like you've been on a quest for continual learning and application, right? So you're not just a degree junkie. You're actually applying it every day.
Right. So actually, I was in that conference with Tom when he was sitting there in the front row, and he turned around like at that moment was, oh my gosh, his book flew off the table because he was like, I got to learn more of this.
Yeah.
And he has. He's dove head deep into the deep end and has, transitioned that into his neurology and done fantastic with it.
Yeah.
So the part of learning is you have to apply it.
Yeah.
Like, what can I learn Monday, through the weekend, that Monday morning, that first patient in the door, how can I apply this to help them? So that's where that functional medicine aspect is. And, listening to your lectures as well, because then it was, Tom, the way you guys taught really resonated with. When you go to other people and they're just reading and reading, it was like, how do I apply this? You do it every day. He was doing it. It's like, okay, this is something Monday morning I can go back and use these gems to help the patient base I have. Part of that is you're still in a silo.
Yeah.
And that's the tough part. And that's why being here in that transition and the move here to start working with you was, wow, I have somebody I can have conversation like this when we do. Like just the other night, we sat here at the end of the day. It was like, what do you think of this and that? We just go through and it's
go
like,
back and forth
okay,
and back
I
and
get
forth.
it.
Yeah.
Right. And working through that process. It's not, hey, here's the answer, or here's what I've done. It was like, okay, let's work through that physiology, the mechanism. What's not working? How do we try and correct that?
So then you go through the rehab program. You go through the neuro program.
Right.
Then what else?
So then,
because I know you have like more letters behind your name than.
So then started doing the functional medicine. Okay, how do I apply this? How do I understand? So then with that, the next degree per se was a clinical nutritional specialist. So I did that while I was still finishing up, and you never stop learning,
right,
as you do. It's a constant seminar, not for the degree, but that was just the next step. And then, when I started working with you,
tell me what that was. That clinical nutritional specialist. That sounds.
So it was more of couple of seminars, and then going through a bit of a, not quite a board exam that we would have done getting your neurology degree or the rehab things.
So the neurology degree has an actual, you don't just take classes, you actually have to pass a pretty brutal test, right?
It's an extremely brutal test.
I know. It was the worst test ever. It was 7 days, and just you basically, I don't know how they do it now. It's like multiple choice, but back then it was the blue book, if anybody's had a blue book, and you basically, here's 17 questions. Each one you have an hour to write as much as you know, pass or fail. Then followed by a clinical exam where you got somebody in a bad case and you got to figure out what to do. So I just, tell us about how brutal that exam was, right?
Yeah, it was a 3-day computer-driven test, and then
So you did the computer-driven test.
like
yeah.
it was one of the first ones where, stressful enough, spending a year to learn 3 years worth of material, neurology, applying it, then sitting in a room where your computer in that whole room constantly crashes.
Yeah.
So now you got to leave, now you got to come back. Then you leave, then you come back. Finally got through that. Then the next weekend was, as you said, the practical part.
That's different. So when I did it down, and for the pleasure of the examiners, we did it in Key West. I did mine in 1997. We did it in Key West, and we took a 3-day written test. It was all written. They had to all be. I think they went away from that because they didn't want to read everybody's answers. But
or their writing.
Yeah, or my writing. And then right afterwards, after we hadn't slept for a week and took this test, then we had to go in on a physical exam on a patient who had like some kind of weird thing. He had to figure out some weird, unique thing. So yeah, it was interesting. It was a tough exam. I have a good friend who's a brilliant functional neurologist in Lancaster, Rob Coder. He took it with me. Just brilliant. But great guy. And he said 1 week of that was worse than 1 week of being in Marine boot camp. Now he said, listen, being in boot camp for the Marines was worse because it wasn't a week.
Right.
But if you had to choose 1 week, he would have chosen a week in boot camp.
Right.
So, but
any week in boot camp.
But he's he can handle about anything physically you throw at him. So anyway, so you go through that exam. That's a difficult exam. Kind of get you board certified, board qualified. You're boarded.
Correct. Right. So I did the practical with the late Dr. John D'Onofrio at his clinic.
The late great John D'Onofrio. Yeah.
Such a great guy. Same thing. You walk in, somebody's sitting there, and they're like, "Here you go."
Yeah. Figure it out.
That was it. And then actually, at the end of that, they give you like 30 short video clips, and you have to diagnose off their clip. What are you finding? What would you do?
Okay.
So they kind of added another component where I guess because they took the blue books away from you.
Yeah.
So you got a little more now. You got to explain what's going on and. What was the test that they just performed and walked you through.
I don't think I'd want to take that test again.
No.
I don't think I want to do that again. I mean, just saying. Yeah.
No, I'm glad I got it done, though.
Yeah. So then you go from there and you're doing this clinical nutrition specialty and then...
Right. Finish that up and then, again, back to school. My wife calls me the never-ending student.
Well, you have to be. It's for the care of the patient, right? Yeah.
Right. So then I just recently... a little over a year ago, got my RN. So I'm a registered nurse as well.
Okay.
And finishing up my nurse practitioner. Hopefully within this year that'll be done, and then I'll be able to sit another board test for that one.
Right. You'll be tested until be tested up and down. So you'll be chiropractor with a specialty in rehab, with a specialty in neurology, with a clinical nutrition degree, with a nursing degree, who's a nurse practitioner.
Correct.
Wow. It's great.
And I think I'm going to stop there.
I would recommend that.
Still,
I don't
still
know.
learning.
Yeah.
But.
So that, and then how did you get here?
So actually, I've seen a couple of your lectures, and then at one point, in that silo, I was like, I got to figure out the cases that you had and the presentation of you take real world patients that actually walk through your front door. They're not just out of a book. Oh, you'll never see this. This is stuff that is seen every day in the clinic. And I believe it was one of the blood chemistry ones that you put up there. It was like, holy cow. I think I've seen something like this. I had no idea what it was. And you, at the end you were graceful enough. I said, listen, I'd love to come out to your office and, just kind of see what you're doing and understand how you're managing. You're like, it's just, I see the patients, I treat the patients as if they're family. Like, okay. So I drove out 3 hours.
Where were you living at the time?
I was living in New Jersey.
Okay.
So born and raised in New Jersey. We lived, 5 minutes from the ocean. So it was a Monday morning and it was a 3-hour ride. 3:30 in the morning, I got up to drive out, met you in the office. And, from then on out, it was, this is something... It just opened up a whole new world of, hey, this is not, something special. This happens every day.
Right.
You don't just see one person like this.
Well, I think I remember saying to you, people talk about weird stuff happening, but it happens all the time. Right. And I believe it was you who was here before you were working with us when we had a patient pull into the parking lot. It wasn't even our patient. Right. They
were supposed to go next door.
Well, they weren't even supposed to go in. The son, who was probably in his 60s or 70s, right, was driving the mother, who was in her 80s or 90s, who had Parkinson's, and she started choking. Right. So he pulled in here, and right next to us, by the way, is family medicine, Holy Spirit, Geisinger, UPMC, whatever it's going to become now. Mm-hmm. Family medicine. He pulled in here, and he comes in, and he yells, "My mom's choking to death," and we're sitting here with a patient. And I calmly, we're like, "We'll be right back."
Excused ourselves.
Walked outside, and she had basically aspirated a mucus plug. We gave her the Heimlich, and she forcefully fired out a mucus plug. Yep. And we put her back in her car and pat him on the head and sent him on his way. Came back in like nothing happened. And you're like, holy cow, that really does happen. It really is crazy stuff. So,
and do you see this all the time? You're like, things happen on a day-to-day basis, and you can't get excited about it. You just you go into that mode of, what does this patient need now?
Yeah.
And took care of her. It was like, all right,
it's
fantastic. And the guy was just shocked, like, oh, that's all I needed to do. It's like, do you know how to do this? He's like, no. It's like, all right, a basic life-saving course would be great for you.
Right. So now, what kind of patients do you see at the center?
Backtrack a little bit.
Yeah.
Everything. So we will see from, infants to, seniors that are in their 80s and 90s. What walks in the door. Just the other day we had yesterday, a little girl whose mom said, thinking of putting tubes in my daughter's ears. She's had ear infections. I don't know what to do. She's almost a year old. We need to put tubes in her ears. So I said, just bring her in. So mom went home, brought her daughter in. We adjusted her. And she said, this morning I contacted her, said the baby slept almost through the night. Wasn't complaining of her ears, didn't have a fever. So we'll see what happens with her. We'll follow her a little bit. But mom came in because a little bit of anxiety. Health isn't where it needs to be. So we're working with her, and she's doing better.
So you're telling me you adjusted a baby?
Yeah.
All right. So tell me a little bit about that. I mean, are you doing the hard with the baby?
Nope.
Are you twisting their neck off? What are you doing?
No. So every individual you have to work within their comfort zone and their ability. So it was enough to do like a tamponade and just tapping through her spine, a little bit of mobilization, extension on her, and then we palpated with a little rotation and flexion in her upper cervical spine, and it moved where it needed to be, and that was all. She stopped crying, and mom sent her home.
It's interesting. I know I have taken care of many a child in my life, and I get that question a lot, like, you're gonna do a baby? I'm like, well, I don't do a baby like I do Arnold Schwarzenegger, but it's different, and it's amazing the results you get. Now, we're not treating the ear infection, we're just kind of analyzing the spine and taking some pressure off the central nervous system and allowing the pressure maybe in the eustachian tube to drain. But I've said for many a day that one of the most effective treatments that chiropractic care has is actually children with ear infections, chronic ear infections.
Absolutely.
So then you'll do that, but the mother who came with an anxiety, you did a full workup on. You didn't just do chiropractic care.
Yeah, we did actually a full workup on mom. We did the necessary lab work on her, and being in central Pennsylvania, we actually ran a Lyme test on her as well. There was a band positive, so we monitor that. But some of her labs were off. I believe her vitamin D was low. She was trending towards anemia. So we're managing that with her, change some diet things, some supplementation that she needed, and she's doing better. And she actually sees Dr. Panantoni in her office, learning some more skills of how to cope with
functional therapist.
Functional therapist, correct? To learn more of how she, in her own world, with her kids and husband, how to manage her anxiety to a level that she's not having attacks as she was. So very well-rounded. The facility offers a lot of different modalities for people through the different caretakers that we have here.
Great. Just a little aside, don't you play hockey?
I do. Actually, I'm going to try and get there tomorrow morning. It's either that or
ice hockey, right? You do full-on ice hockey, right?
So I've played hockey since I was 6 years old.
Yeah.
And continue today, and I'm a little older than 6.
Yeah.
So probably the last 49 years.
Do you see a lot of injuries in hockey?
Nowadays, it's like with most sports, you see a lot more concussions.
Do you deal with a lot of concussions?
We have seen that, and that's part of the neurology part works out really well.
Yeah, I imagine that would tie in real nice to the neurology.
Yeah, it ties in very well with that to explain, because a lot of it is...
So isn't the treatment for concussion just go home and rest?
That's the standard of care that they kind of laid out for people. But
you don't do that.
No, there's so much more. We have testing that you do. So there's a test that came out years ago, the impact testing.
Out of Pittsburgh, yeah.
Yeah, out of Pittsburgh. But there's a lot of newer tests that are out, which I think are a little more functional to help the patients. But finding out why with the neurology is, as you know, the eye movements are the window to the world, the window to the brain. Mm. So we need to look at that. A lot of that is missed. And I believe I just saw a paper, Dr. Carrick and the program we're putting together, that vertical eye movements are very significant in that concussive protocol that they...
Yeah, those saccades, those rapid eye movements back and forth. And I think a lot of times it's missed. So, I watch the TV on the weekends and we watch football and they're getting their concussion screening. And it's kind of I would say that there may be an opportunity to do a more detailed exam. And then, so then you don't do just rest. So what might you recommend? Like other than, rest is important, I imagine.
Absolutely. Rest is important. You don't want to overstimulate, because right now the brain is inflamed. You don't want to overstimulate that. So utilizing natural anti-inflammatories, things like a turmeric or resveratrol, and then the hyperbaric chamber, getting them into the hyperbaric, hopefully within the first 24 hours, at least 2 to 3 times is ideal.
Yeah, I've read that. It's really important to now, I've also seen cases where it's been 6 months before they get in, and they do have benefit, but it's real important to get in right away after the injury.
Correct.
Right?
Yeah, as quick as possible.
Yeah, so they get in the hyperbaric, they do some flavonoid inflammatory reduction of brain inflammation, if you will, right?
Correct.
So you're taking action right away.
Absolutely.
Which kind of makes sense to me. If I have a big cut on my arm, maybe I need stitches, not just rest, right?
Right.
So the brain's the same way.
Absolutely. The brain is, it's the engine. It runs everything.
And if you take action against that, I've read some studies. I've actually read a lot of studies, but I've read some studies that it can possibly reduce a secondary concussion, right? So it's just rest. You're hoping it resolved all the way, but the resolution of the symptoms doesn't mean you don't still have that glial priming going on in the brain. So, the first concussion, the kid gets a whack, and then all of a sudden they think they're fine to get a little tap on the head, and they get a major concussion. Talk about that secondary concussion.
Or they get a stressor that drives that, which you see with maybe a car accident. Maybe they fall off their bike or, get hit in the head with a snowball.
Okay.
So they're priming the initial, if not corrected or seen appropriately, and you go through some of that we just discussed, is now you're never resolve the initial one, so you're compounding it with the second or third or, the multiple ones. Or, well, it's not bad enough, don't think it's a concussion, which it truly is. And then that just glial priming, which you were saying was just the brain actively driving that now aberrant pattern.
So how is it that you play competitive ice hockey? Do you see a lot of opportunity to even change athletics and how people are prepared from a nutritional standpoint to prevent a concussion?
Yeah, I think there's a lot more going that way, which, you're a great fan at Notre Dame, and there's a lot that you see there happening, some things coming out of there, but even they're changing the helmet structure for the individuals to lessen the impact. They're still, it's like running into a brick wall every time these linemen hit each other or somebody gets tackled. So preparing their bodies, their brain to nutritionally, why are we putting inflammatory things in our body, which is only going to drive that you're setting or...
So what would you say is an inflammatory thing that you eat?
Some foods. Gluten would be huge.
Okay. Sugar maybe?
Sugar would be absolutely up there.
Processed foods?
Absolutely.
And then lack of phytonutrition such as vegetables and fruits maybe?
Right.
Yeah. So...
And color on your plate's a good thing.
Yeah. So, I'm a big fan of... You get a chemical concussion by the diet you eat every day. And I don't see that kind of drifting over as much into this physical world. Like, I don't know what you're seeing on the ice hockey rink, but, if you're drinking a six-pack after you're playing hockey, something like that. And so, or kids, they're eating high-sugar foods, and then they're going out and playing hockey. I'm just wondering if you've seen, since you've played this for, what are you, 20, 30 years old?
Almost
something
there.
like that. Yeah. So but more than a day. But the point is, you've been playing this since you were a little kid, and I'm making very, very, very general stereotypes, but home cooked meal by mom or dad.
Absolutely.
That's and now to McDonald's meal on the go with a French fries and a shake. And now you see these kids get concussions at such a young age when it's almost predictable, isn't it? Don't you almost expect them to get more concussions?
Absolutely. You see that with, it's one of the first things we ask is, so how's your diet? What do you eat? And if they come in with a McDonald's bag, you already know that.
And do you ever get, I came here for a concussion, what do you care what I'm eating?
Yes. But
Okay.
that doesn't have anything to do with this. Well, it has a huge thing to do with it. If you drove a car or a truck that was a diesel vehicle, why would you put regular gas in it?
Yeah.
It's the same thing with the body. What you're eating is the fuel that's going to drive that brain. It's going to drive your body. So why can't you, or wouldn't you, put the best you possibly can in it? So you would see that. You would see, somebody that ate a decent meal or a home-cooked meal versus running to McDonald's and eating.
Not picking on McDonald's. Full disclosure, I'm not picking on
Absolutely.
McDonald's, right?
Or fast foods.
Right.
So they're eating fast foods, and you could see during a practice or a training session, halfway, three-quarters of the way through, they're just spent. There's no more energy. They're already done.
Yeah.
So how would that individual, if now they got hurt, or on this line is a concussion, how are they going to rebound from that? Well, they're not. They're already in a bucket.
Yeah. Yeah, it's interesting.
Yeah.
Interesting.
So
what are so you see pretty much birth to 80s, 90s, right?
Yeah.
Yeah. And it's all individualized care as far as what you're going to do with them and for them, right?
Yes, everybody, it's like the blood test. Everybody's different. Not two people are going to have the same blood work.
So, you're going through this full-on nurse practitioners program. How do you see that evolving in your clinical acumen? Where do you see that going?
I think it's going to be a benefit to the patients because it would allow me to have the ability to sit with them and say, okay, you came in because your health is not where you want it to be, but you're taking these medications. Why are you on the medication? If we can change diet, lifestyle, which I feel is one of the first things we should do before we start to give them the medications. Okay, as an example, somebody's on a statin drug. Well, why are you taking that? Well, my cholesterol was high. Well, why is your cholesterol high? Did we look at these other predictive?
Yeah, I see all the commercials. When diet and lifestyle is not enough, then you say, what'd you do for diet and lifestyle? Well, nothing. I'm like, well, maybe it's not enough because you gave it zero accountability attention, right?
Right. Or the lifestyle change is a lifestyle change. Your life is a destination. It's not a sprint.
Right.
So we need to make those changes for that individual. Do they have the ability to do that? Somebody has a farm. Okay, you're on a farm, you're canning, you're eating all your vegetables, you have that. versus running out to a fast food place. Well, my vegetables are French fries.
Yeah, with ketchup.
With ketchup, the tomato.
Tomato. What, so, you and I have spoke a little bit about maybe getting into more of the stem cells, axolotl, into joints, regenerative medicine. Is that something you're interested in?
Absolutely. Which would be fantastic for we were on the subject of athletes.
Yeah.
If there's an injury, if something's going on, how about when they're younger, not, I'm 55 and I think I have to have my hip replaced.
Right.
Well, let me do a stem cell. I think that'll fit. Well, your hip is too far gone.
Yeah.
Maybe you do need that. But if we get them at, 20s, 30s, or, younger, they're still trying to make their own. So if we can help the body to be as efficient as it can, maybe that 50-year-old doesn't need a hip.
Right. No, that's the goal, is to kind of get to it before it gets to them.
Absolutely,
right? So,
yeah.
Excellent.
You want to take care of that down the road.
What other things, is there any other pieces of, are you going to kind of, our flavors change? You plan on going more into children, more of the stem cells, or do you see yourself as kind of, I want to be a generalist to take care of all of it? How do you see yourself evolving here?
I think starting, out of the box, probably the generalist, and find out where the practice goes, what drives, and, what's the need.
Right.
Are we starting to see more kids? Hey, and then, like you talked about, the athletes, do we need to get into that a little bit more? Because now they're showing up saying, hey, listen, I don't want to be that 30, 40-year-old who needs a knee, who needs a hip. How do I prevent those? I've had some injuries early on. How do I prevent that later on in life? Because I want to be that 65-year-old grandfather running around with my grandkids, not, sitting in a corner drooling or, whoa, grandpa can't do that. I'm, sorry.
Yeah.
So apologizing for not being able to live life.
And I mean, for those that can't see, John Dr. Brow he lives it. I think you probably wear the same pants you wore in high school. Not from a clothing standpoint, but from a size standpoint. I would be willing to guess how much you weighed, whatever it was. Literally, you look like you don't age.
A little bit more.
I don't believe
A
that.
little bit more.
I don't believe. You don't age. You're like ageless, John. So in your own lifestyle, you do. I know your wife is a yoga master or yoga instructor or whatever they're called. But you do exercise frequently, correct?
I go out with the kids. So I have 4 kids and I've coached them at soccer. And
keeps you active. I know I've coached, and it keeps you active just coaching.
Right.
Your diet is pretty good, would you say?
Yeah. So we've been for years and trying to explain this to patients. They're like, oh, that's so hard. I said, I'll never tell a patient something that I or my family has not done. So here's the dietary changes. Oh, that's going to be hard. Change is hard, but you have to be willing to do it for yourself. Nobody can force you to do it. So we eat gluten-free, dairy-free, consistently. I love to cook. I love to bake. So everything we make is gluten-free, dairy-free.
And it tastes so. Dr. Brow brings stuff into the office and makes stuff, and honestly, if you weren't a physician, you'd be a cook or a chef, right? Or I don't know if you would be, but you have the skills to be. I've seen some of the things you do. Now, how did you get interested in? How did you learn? It's not like you saw a podcast. Like this is something you do to a level that rivals professional chef.
So I started when I was 14 working in a restaurant. Okay. I was the dishwasher.
Okay.
So we were at the Jersey Shore. So the restaurant did over 2,000 dinners a night. So the dishwasher was 14 feet long.
Okay.
So I started there and said, I don't want to be here cleaning dishes for 2,000 people every day. So I started to progress up the ladder of now I was in the back, shucking clams, oysters, cooking lobsters, cutting lobsters. And then it was like, okay, then I started making soups and then slowly worked my way into, then I was running the restaurant. But the whole time, my journey never changed from starting out being a doctor and a chiropractor.
Right, yeah.
So it was always, that was what allowed me to get there. So at one point during school, I said, okay, I need to pay for my education. How am I doing this? So I started baking cakes on the side and selling that and decorating cakes. So I did a little bit of that. Came home I went to school out in Chicago.
Okay.
Came back to New Jersey. A friend had a catering business. So I started helping her for a couple of years, waiting to get my license. And just from then on out, it was, okay, hey, it's a birthday party. Let me make the cake.
So you have no professional training as a chef?
None.
That's amazing. I mean, I've tasted your food. Mm-hmm. It's a crime to humanity for you not to have a restaurant. It's just and it's not cake. I mean, clearly, you can bake cakes and stuff. I know Tara, who's our IV nurse,
right,
whom everybody loves. She was here. Actually, she was here working late, taking care of patients, mm-hmm. and her child needed to bring cupcakes to school, and they needed to be gluten-free and dairy-free. Right. For her, because her child needs that, and she couldn't do both, so she said, how am I supposed to serve these patients, which is my primary goal, while I serve my daughter, mm-hmm. which is my primary goal.
Correct.
So you were gracious enough to make the cupcakes and, of course, shared them with the staff, in which case we all... But you do that with chicken. You do that with everything. So how did you learn how to cook like that? Just doing it.
Really? Yeah. And I explained to patients, they're like, oh, how am I going to make this? I said, there's always an alternative. You can always, does it come out the way you want it all the time? And, like you're talking about is, I don't taste my own cooking. I let my wife do it. I let the kids do it. And they're like, oh, that's good. And I'm like, okay, let's eat then.
Yeah.
So I'll make something. They're like, I don't know. So I'll tweak it.
That's empowering too, because you have no formal cooking training.
Mm-hmm.
Now, I couldn't do that. Now, my wife can cook and make stuff taste good. It just doesn't present well, as you know. She can make a chocolate cake like you.
She does a great job.
She does a phenomenal job. The cake tastes really great. Mm-hmm. Yours looks like it was done at a professional bakery. Hers looks like she dropped it on the floor. But they taste very good, right? They taste very good. So, but I think it's...
So close your eyes and we'll just,
eat it,
eat it, and it's perfect.
Like there's that show, what's it called? Where they have to reproduce the cake. Anybody know what I'm talking about?
I do.
Yeah.
The name
like boom,
me,
like there it is or whatever.
There it is.
And my daughter watches that and like, nailed it.
Okay.
Nailed it. And I'm like, it looks nothing like it, but it may taste good. So listen, it comes back to, how am I supposed to eat this way? Here's somebody who had no professional chef training, who changed his entire presentation on how to address it and eat food.
Yeah, and you can make soups that way. You can make, like you make your chicken that way, make other things. There's always an alternative to it. It may not come out right the first time, but you just slowly, okay, what do I need for this recipe? Okay, if I take that out, if I take a standard flour out and I use a gluten-free flour.
Right.
If I take an egg out and I use this. If I, whatever the alternative for them, because everybody's got different likes, different dislikes, or dietary modifications they need.
And I know for me, not being a cook or a chef or cooking or chefing,
right,
is I would learn the science. Like, listen, here's what I want you to eat. Meats, fruits, vegetables. And with Carrie, our nutritional health coach here, it's nice because I'm like, I know what you need to eat. I don't know how to prepare it. Right. And you're too busy being a doc, so I'd send them down to Carrie, and Carrie would walk them through recipes and stuff. So
exactly, and recipes are great, and sharing recipes are even better. So I was just talking to Dr. Shannon the other day. We were talking about, I went somewhere to find, there was a bakery that does gluten-free stuff, and I was trying to find a pizza dough, but they were closed. I'm like, all right, let me figure this out. So I went home and made it. And my kids were like, hey, this is good. Okay, let's tweak it a little bit.
And it's like the Pennsylvania Bakery, which is kind of they make gluten-free now. So it's a really great bakery.
And it's nice that other places are starting to see the importance of this and start to make those changes.
Well, and I think what we're in the process of putting together here is a cookbook for the office. Just bring us your, not really for monetary reasons, just, hey, bring us some good recipes so we can share those with people, because we want to be part of this community of support. So, yeah.
And somebody may not know how to do that. And you're like, look, here's a simple recipe. You can put this together and the family will enjoy it.
Yeah. So another thing too, we talked a little bit about the kids and the neuro-atypical, and I can say this, like when a kid comes in, no matter, we were actually just talking about it before the podcast. Kid can come in with any behavior issue, and it's almost like no problem. You just take them right in your office. They can do whatever. It doesn't upset you.
Yeah.
I know parents are a little bit apprehensive about bringing their child in, and you're always like, it's not a problem. I got this. Like, your kid is not too big an issue for me. So just kind of calming a parent down, like, yeah, but you haven't seen my child. Kind of going back to the patient in the parking lot that we had to get the fur ball out of. Your ability to just say, it's a big issue to you because you're a statistic of one. You're the only parent going through this maybe.
Correct.
But for you, Dr. Brow, you're like, I see this all the time. Mm-hmm. So you bring your child here, I got this. It's okay. So
and that's big is you have to be able to connect with the parents and say, we'll work on this together as a team. Yeah. You're not alone anymore. We'll do this together. Yeah, your kids run around banging things on the table or they're, knock something off my desk. It's okay.
Yeah.
Like, no, it's not. It's fine. They're not going to break anything.
Yeah.
It's okay. If they break it, it's okay. If I didn't want it broken, I wouldn't have it here. It's okay. Right. Like, are you sure? Yes.
Yeah, just kind of de-escalating the situation. Yeah. And I do have to throw in, because we were back in the break room talking with Dara, our IV nurse, who I said we're going to do a podcast with because of her value to the office.
Absolutely.
And, real quick aside, when my child was special needs, we had brought him down to Johns Hopkins, and they put him in a straitjacket to try and get blood out of him for 45 minutes, and he wiggled out of the straitjacket. Meanwhile, they didn't get any blood out of him, and he's sweating like he just ran a marathon. And then they said they're going to do the other arm and try. I'm like, no, we're not. And I took him, and I said, we're going to go home. He's coming with me. And we went over to the lab, and Dara was the phlebotomist there.
At that time.
And I held him, and within a minute and a half, she had all the blood out of him. And I said, one day, and that was 12 years ago.
Right.
And our office was 3, me and 2 support staff, right? And so I said, one of these days I'm going to hire her to support the community, because now my son, he'd go in and get a blood draw, no problem. So it wasn't for me, but I was like, that again needs to be in a center where her skills are met with the challenges that are needed by the community. And we bring a child in, and you, I know specifically, sometimes I do it, but you will hold the child with compassion and caring and firmness.
Right.
Hold the child down, and Dara gets the blood out of him. So.
And it just makes it easier on mom and dad because they feel tentative to have to restrain their child at times for that. It's like, it's okay. We got this. We'll take care of it for you.
Yeah.
Just have a seat, hold their hand, and that's all you need to do. Hold their hand, be their parent, and we'll take care of the rest of it.
So it's interesting. So you could really assess and address a child with neuroatypical needs, right? So anything from behavior disorders, attention deficit, all the way to maybe autism, dyslexia, even just a slight coordination difficulty. Transition that further into childhood athletics, and so taking care of an athlete who may be at risk for a concussion or had a concussion, with nutritional support, up to someone who might be early middle age, suffering from an autoimmune disease, not feeling good, and then transitioning even into later in life. So you kind of got this span from birth till late age.
Anybody that needs our help, we're here for them.
Nice.
We can take care of that.
But you kind of have a command of that entire lifespan.
Yeah, I think that was part of, growing up in a big family as well, is there's a lot going on.
Yeah.
You see that as well.
We were talking earlier with Dr. Panettone and understanding trauma, understanding loss, understanding, what it means to have the emotional component of it.
Yeah. We're trying to reach all aspects of people's lives to support that. Like you were talking about the scope of those kids, the neuro-atypical children. I have a couple of children that have Down syndrome. They come in, they'll walk over and want to sit on my lap and just chat. I'm like, all right, here's your chair. You sit next to me. We'll sit on this side. Let's talk to mommy and daddy on the other side. And they think that's fantastic.
It's so unique, and it's a small gesture for you, but a huge gesture for that patient and the parents, just to say it's okay.
Yeah.
Or I know I've seen you get on the floor with the child and just, whatever it takes. So
Yeah.
So I think that's, I know for me personally, it's been a true blessing to have you as part of the office, and grateful that you're here.
And
just
I'm
want the community to know that you are here, and some of the skill sets that I'm not really good at, maybe promoting the skill sets that you have. So for people to know that you have advanced training in rehab and neurology and children who are neuro-atypical, and all the way up through, we didn't touch on it, but I know you've lectured with Dale Bredesen as well, and the aging and cognitive decline and everything in between. So
yeah, it's been a pleasure to be here, and every day is a new experience. Every day is a challenge, and it helps us grow as clinicians to say, okay, I don't know exactly what we're doing with that, but we're going to figure it out. Yeah. And we do, and patients want to know that you're there with them and for them, and you're an advocate as well.
Yeah.
You're just not, it's this here and you're on your way. Here's a simple fix, you're on your way. Well, if there was that, magic pill, everybody'd have it, everybody'd be taking it, but it's not. Yeah. So you have to connect with them on all levels to support them.
Nice.
So that's what I feel is the grace that we have, and the ability to see that in each other. And if I need somebody that I need to send down the hall to Dr. Panettone, she's right there.
Right.
If I need to send them, like you said, to Carrie, she's right there. Suzanne, what staff, what individual in this office is going to help serve this patient
or
to the
other
best?
Office, right?
Or other offices.
We're not really, it's not arrogance that we have to do it here. Yeah.
Down the road, we work with, Dr. Williams down the road, who's the hematology oncologist. Hey, listen, we need you to go sit in with him. Okay. And they come back and say, wow, that was great. Thanks for helping me out. I appreciate that.
Yeah, I think that there's just answers to problems that people have already said there's no answer to my problem. And I think we want to be an opportunity to answer the questions that they feel there's no answer to.
Right. Yeah. And it doesn't matter if we're their first doc they've seen, or, I think that you've had up to somebody that's seen 50, 56 or something doctors 50, and went, you're my 53rd. What do you do now?
Right.
So they've been poked and prod and tested along the way, but
you get it from a different paradigm.
Right. Different paradigm, different set of eyes. How do we help you? What do you want? Yeah. Which is a great question for all the patients, is what do you want? How can we serve you?
Awesome. Well, Dr. Brown, appreciate you coming in today. It's been great to get to know you, and hopefully the community gets to know you a little bit better. And again, a true blessing to have you. Thanks for coming in and sharing this morning.
Thank you for having me. It was a pleasure.